Good morning, everyone.
Okay, this time we will have a moment of silence, and then we'll do a pledge to the flags, and then we will have our we have some guests to speak this morning, and I'll introduce them at that time. So if you would, please join me for a moment of silence, and we'll also have a pledge. Please join me in the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Pledge to the Texas flag. Honor the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one and indivisible. Thank you. Okay, I would like to introduce this morning Dr. Bill McCunniff, who's current president of the McLennan County Medical Society, and then with him also is Dr. Clint McHenry, and I guess he is the president-elect, or will be the president next year, and so appreciate y'all coming. I know that the
I can't, they ain't saying nothing. Everybody's still muted.
See, and so thank y'all for wanting to weigh in this morning. So Dr. McCunniff, I'll give you the floor.
Well, thank you. I appreciate you inviting us to both participate. This has been such a unique and pivotal time in our country's history, but also locally. And I know that as a family medicine doctor, along with Dr. McHenry, both family medicine doctors, this is something that in terms of coronavirus that we are just inundated with every single day, particularly over the last week. It's been a time that's been trying because all of the data that the public receives and the data that the physicians are receiving from our standpoint changes so quickly as we learn more and more about this virus. About 2 weeks ago, the McLennan County Medical Society introduced a resolution where we did advise that the public and employees and employers, and then people that were visiting businesses would particularly wear face masks in order to help decrease that risk of transmission from asymptomatic individuals to others in the community, particularly the immunosuppressed and those who are particularly high risk. And so that is our recommendation, and we sent in that resolution about 2 weeks ago. If there were other particular questions or things, I think Dr. McHenry and I would also be happy to weigh in for other concerns or questions.
Any questions anyone would have?
With regards to, is this the format in which we should ask questions about tracking and not necessarily, I mean, are you here to answer medical questions, or are we going to get into what I'm wanting to know is are we keeping track of the manner in which this is spreading? Are we categorizing it? Are we keeping a percentage of how it's spreading? Could you answer that?
I would say that in terms of my role as the Medical Society president, I'm involved in some of those conversations, particularly once a week with the county health department, they're the ones that are responsible for the contact tracings and a lot of the detailed information about how successful we are in terms of identifying those contacts. I would say that I'm not the authority that is going to be able to answer those detailed questions in regards to any particular detail.
Okay.
Okay.
Are we going to have someone this morning that will be able to address that?
I don't know if Elizabeth's on the call.
Okay.
I had a question about the mask, if you can answer.
I don't have any issues there. Mine are more with regards to questions of locations and percentages and things of that nature.
Good morning, Commissioner Perry. I might be able to answer some of those questions when it comes to the public health district and that contact tracing. I'm assuming you're probably wanting to know a lot of what they've been seeing over there. We just had our 8:30 morning briefing, is that they have a lot of what's called family clusters right now. So they have people that are gathering in small groups, and then they go back to their normal households, and then they take it back, and it kind of spreads throughout these households. So they're seeing these small family clusters. As for restaurants and et cetera, like businesses, they are starting to work on keeping a tally of, kind of where the restaurants are so they can see. But overall, it's kind of spread throughout the community. There's no real, what I would call like a hotspot area. It's kind of pretty much anywhere and everywhere. Does that make sense?
Judge, we can't hear you.
I can't hear him either. Can anybody hear him? Mm-mm.
Can you hear me now? All right. I apologize about the audio. I think Dr. McCuniff, I appreciate you and Dr. McHenry coming on this morning. We did get your resolution, and we appreciate your input. Sorry about the audio situation.
I had a question on the mask for the doctor, if he could answer.
Okay,
So from what I've gathered, the mask doesn't keep you from getting it and doesn't keep anybody else from getting it. I mean, you can still get it. It's kind of a false sense of protection because you can still breathe it in. So if you're at risk, why wouldn't you just stay at home? And that way you're not having everybody wear a mask that doesn't need to wear a mask. They're not medical, surgical type masks.
I'd say that's a very common question that I'm getting on a regular basis. And the biggest thing that we've discovered with this as time has gone on is that this is a respiratory droplet type of transmission that occurs whenever someone sneezes, coughs, speaks loudly, things like that. And so whenever someone is wearing a mask, that's where whenever some of the droplets that this virus may be bound to is caught in the mask instead of being transported outside. So you're exactly correct in terms of that. It's not protecting the person who's wearing the mask. What it is doing is decreasing that risk of transmission to the other person on the other side who is hopefully wearing a mask as well. And so thus studies have shown that if the person who is maybe asymptomatic and not showing any symptoms is able to wear the mask and able to trap those particles inside the mouth, that it may not get to the other person. Now, the argument about the high-risk individuals staying at home, that's something that I talk with patients every single day about, that I would love for them to be able to stay at home. And I would love for them not to have to get out and go to the grocery store, pick up their medications. And so we talk about ways to get around that. But that's the biggest problem, is that for a lot of these people in some of the rural areas or those without family members in town, they're kind of forced to go out into the community themselves. And so that's where we as particularly potentially lower risk individuals wear a mask in order to help protect them. Dr. McHenry may have some other thoughts on that as well.
I mean, not a lot. I agree with everything Bill said. One other thing to keep in mind here is that it's not just high risk people that this virus is affecting in some pretty serious ways. Even locally, we've seen relatively young, relatively healthy people get really sick. And I know in one case, one of the deaths here was a relatively young person with no severe underlying medical conditions. So it's also some of the unpredictability of this virus and just doing everything we can to help decrease that community spread. Because we are seeing this also happen in clusters. And so you're potentially spreading this to someone who's not high risk, who then can potentially spread it to someone who is high risk. So that's some of the reason we're really recommending masking. And that's come from here locally. And then also, as you've seen, from higher up even.
okay. Other questions? Okay, again, well, thank y'all very much. And
He has no audio.
I'm sorry, for some reason or other, my microphone keeps going off. No. Okay. All right, can you hear me now? All right, that's when they can hear me. I'm sorry, but again, thank y'all for joining us this morning, and please keep in touch.
And one other thing that I was going to ask too is, I know the numbers are going up because of, obviously, if you're testing more people, the numbers will go up. But how many people do we have hospitalized right now? Anybody got an update on that?
That's a Elizabeth question.
Yes, sir. I'm pulling that up right now. I believe as of yesterday, there were 17 hospitalized. Yes, 17 cases are hospitalized. 11 of those are McLennan County residents. 5 cases are on ventilators currently.
Of course, a lot of the increase is due to more testing, but also the productivity rate is increased considerably as well. Where only a few weeks ago, we were at like 0.5%, and that has gone up tenfold to over 10%. So that's the percentage of people tested that have tested positive. So that's a key factor and kind of an alarming thing that's happening right now is the productivity rate going up.
I just thought of a question for Dr. McCunniff. When we all started this about 3 months ago, it was we were looking at these models, and no matter what we did, there were always going to be a certain amount of people that got this virus, no matter what. I mean, and so we closed our economy, and are those models still, are we still looking at those models? Are we still thinking that the same amount of people are going to get it no matter what, our mitigation strategies are? I mean, what's the medical community's feeling behind that?
I would certainly say that the models that we're watching continue to change and adapt. And this is a virus that, just like you said, people are unfortunately going to contract, and it is going to be, dispersed about the community, about the state and our country. That being said, there are direct correlations between mitigation strategies and decreasing the number of people that are potentially infected, and ultimately the deaths, which are what we're all trying to prevent. So there are a number of models that we continue to follow there's one out of University of Texas, and there's a couple other ones around the country, which give different predictions, and based on how effective the strategies are and the mitigation strategies, then we potentially see the direct correlation and the decrease in the numbers.
Has there been any study that shows the amount of people that?
I'm sorry, you cut out just as you were saying that.
What was that question?
Has there been any study that correlates mandatory mask orders and the amount of people that get the virus in the community?
I have seen one article that came out. There has been several articles, but the one that I have right in front of me is one that was just produced in June 16th. And it literally looked at that exact same question about, are there state policies mandating the public or community face masks and mitigating the spread? And because it is controversial, and what they did look at was the enforcement of U.S. Face masks in public settings in DC between April 8th and May 15th. And what it did show is that requiring face masks was effective in reducing that rate by about 2% after 21 days of enforcement of the face masks. And so there have been a number of studies that have come out. In full transparency, the number of articles coming out has led to a lot of the misinformation that you see passed around on public sources or on social media that, can get interpreted one way or the other in terms of the support of an argument. But this is one of the most recent and most clearly stated articles that I've seen recently showing that benefit.
Is it the Texas A&M study?
This one was out of a University of Iowa wrote this article.
And the Texas A&M study that was in conjunction with University of Texas and some other medical professionals did do an extensive study on face masks that showed that they were effective in reducing the spread. In other words, for you wearing them, and if you are asymptomatic or sick, it reduces that. That's a recent study that commissioners have seen as well. So there's a lot of debate about the various degrees of how beneficial they are, but I think I haven't seen any study that said they don't work at all. And you know, the medical community has been wearing face masks for probably a century, but you don't have to go far to find out where it is effective.
So Bill, I didn't quite hear what you said. You said that the Iowa study said that it only decreased it by about 2%.
That was the decrease the growth rate by 2 percentage points at 21 days. And so what it was showing was the growth rate, even after they measured it every 5 days, and it continued to show that decrease continually decline as that time went on. And, you know, that's in conjunction with the other measures, which we're all aware of: the social distancing, the washing their hands. And then I've had a lot of questions about the dangers of wearing masks. Is there risk of carbon dioxide increases when someone's wearing a mask that's too tight, or headaches, or people hospitalized? And I think just like Judge Felton had mentioned, that the hospital employees and physicians and nurses have been wearing masks for a long time, and we haven't seen any evidence of any dangers of wearing masks, only the potential for improvement and improved safety and decreased transmission within the community.
And that 2%, was that it affected the positivity rate? A while ago, I kept saying productivity rate, but it's positivity rate.
Positivity rate.
So is that the factor, 2%?
Yes, sir.
Okay.
Well, I would just say that as far as the county goes, I feel like if an individual city wants to put a mask in place order in, that'd be fine. But I don't see that we need to, step out and say everybody needs, and who's going to enforce it on top of that?
Okay. All right. Well, that's something we'll get to on the agenda. So we'll have plenty of time to talk about it.
I do have one more question.
Yeah.
For Dr. McConough. Sir, if you could, have you been, or do you know of anyone that has or has been requested to visit with our smaller cities and municipalities with regards to the COVID?
I believe your question was, do I know of anybody who is asked particularly to go and visit to some of the smaller cities about COVID? Is that correct?
Yes, sir, it is.
I have not. I do not know of anyone in particular that is asked in terms of my position or what I'm doing currently. I do think that you all thought that there would be potentially somewhere or some way that would potentially be helpful, we could set something up, because I think as this has progressed, the health department, the medical society, the city of Waco, there's been a lot of good teamwork. And so I do think there is that potential if something like that was needed, but I haven't had anyone approach me particularly about that topic.
Thank you.
Any other questions? Okay, Dr. McConough, again, thank you very much. Apologize about the audio, and if there's anything we can do for you, let us know.
Thank you so much. Have a great day.
Thank you. Commissioner Perry, on your question about if the other cities accessed or had information, I know that they've all been looking at the CDC protocols because they mentioned it, because they have businesses and they have events that they've got to look at as well. But I don't if we need to do, more, then we can sponsor
I
that.
would think they would have questions that would relate to their community and not necessarily us countywide or globally. And I think, it's a big step to mandate someone in this particular day and time, something such as this. And I would think that we would want them to be armed with as much information as they need as they make a decision on what's in the best interest of their community. And I would hope that we could figure out a way to facilitate that and make sure that any question they may have, they would have the experts in front of them to be able to ask it.
Judge,
Yes, ma'am.
I know last week I participated in a Zoom call in one of the smaller cities. What they stressed in that meeting is that they were waiting to see what the county was going to do. I know some of our larger municipalities have issued mask orders, but what I gleaned from that conversation is that a lot of the smaller communities are waiting to see what the county's going to do.
Right. I think you're right.
So I would agree in some instances, but at some point in time too, they need to do what's in their best interest.
I mean, I think from talking to you though, most of them are on the city manager calls. Isn't there a city manager call
Right.
every week or every day or?
It's
Something like that.
it was every week, and now it's every 2 weeks.
Mhm.
And they're generally following the Wednesday press conference and
Who
information.
conducts that call?
Kevin Evans.
And who is he?
Oh, he's the city manager at McGregor.
Okay.
Yeah, he came, in fact, before COVID-19, he thought it was important for city management of the various cities to get together and talk about common issues. And so he set that up for discussion on those things. And then since then, those calls have primarily been around COVID-19. The last several, probably for the last 2 or 3 calls, that's totally, they, looking at the information, looking at the city's orders, and asking questions like Wiley Stem or Bradley would be on the call. And so they would answer questions that they might have to the city. Well, if,
Judge,
and I'll move on the agenda to go to the, under E, is discussion or action regarding the COVID-19, include but not limited to staffing, emergency appropriations, precautions, and plans. On E2, on E3, I'm going to skip down to E3, is a discussion, consideration, and potential action on adopting an order requiring businesses to establish COVID-19 policies applicable to the employees and customers, including face coverings, sanitation, and social distancing, or a resolution declining to adopt such an order, and other recommendations of the court. So in your package, you received an order that was crafted by our attorney that was pretty much came from the initial orders that the city of Waco first established. And then I believe in chronological order, the city of Woodway established the next order. And then the city of Hewitt, which Mike Dixon, our attorney, worked on that one. And so there was, I think, some improvements made, which would be, if you have any questions about that, we'd ask him. But I would open the floor to discussion regarding the order. Some of you've already made comments about it. But any questions you have on it or any opinions that you want to express on it, well, please do so at this time.
Real quickly, I'll say that the enforcement piece is a no-starter for me. I think we've inflicted a lot of pain and damage on our smaller businesses, and I think to turn around and put the enforcement of the border on the business, and if they don't comply, face $1,000 fine. Discussion of an order is okay with me, but I can't discuss it if we're going to continue to talk about forcing a small business to be the enforcement arm of it. And then I also would want the opportunity to speak with the city managers in the precinct, and quite honestly, across the county, before we pass an order. I think their input should be valued, and I would definitely want to visit with them before we did anything.
Well, I think
In regards to the enforcement piece, is that I'm just pitching it out there, and it may take the value out of the order, but if that was deleted, could you support it?
Depending on what the city manager.
Yeah, sure.
I would be willing to discuss. This is not anything I just want to sit down and determine that this is what's best and we move forward without additional input. I still have some questions that I would want to ask with regards to, are we keeping percentages of spread on different categories of spread? We know what the percentages are.
Yeah.
So there's some things I would like to find out. But the biggest issue is I don't want to move forward and I won't buy in from our smaller cities. I want to know if they're against it. I want to know why. Is it an economic reason? Is there something they see that we don't see that would keep them from supporting it? And if they come along and support it, that's a different story. But this would require a whole nother level of consultation before I would be willing to vote.
So how much time do you need to be able to do that?
I would hope that I could do it in a day or two.
Because we have a meeting tomorrow, which also has the emergency order on there, so we can freely talk about it then if we don't move forward today.
I tend to agree with Commissioner Perry. The data that we have is very incomplete, and and the lack of data is concerning, and the fact that we're going to decide on a very onerous, very restricting policy of fining a business $1,000 for not complying. We're going to make such a huge decision, and frankly, we've been left out of the loop on most all of the data and the decision making. So I'm not ready to and then to try to come up with some enforcement when we don't have any type of code enforcement protocols or anything like that. So.
In regards to the information, the two website, it's COVIDWaco.com. There's a tremendous amount of information on there, and that's what everybody's going by. I mean, it's broke down to areas of the county. It's broke down to ethnicity and age, and how many people are in the hospital, how many are currently being treated or sick, and how many have recovered, how many deaths, and you can go down and break it down.
Well, I've followed that website extremely closely, and it seems though that it doesn't give specific people who are in the ICU or how stressed our ICUs are right now or anything like that. How stressed our hospitals are. it would be nice to know and specifically who is getting sick and why they are getting sick. And I just can't believe that it's just people who work together for a short period of time. I'd like to know, are these people going to nightclubs? Did they participate in the demonstrations weeks ago? Are those questions being asked?
They are, and most of them are being published in the paper. It's community spread, and they're thinking a lot of this right now is kind of when the economy was opened and people were getting out, to beaches and other places like that, but also in within families. But I think every bit of that is reported.
And Clary, this is not so much, for me, this is not a debate of does a mask work or does it not work?
Right.
That's not the debate. The debate is are we going to allow government to do what government should do, or are we going to intervene and decide what's best? And that's where I struggle.
With the other cities,
municipalities.
when they've got the authority to do an order.
Right. And knowing that we've got currently at least 62% of the population in 3 cities that have already adopted orders, who I support. I wear one everywhere I go that I'm supposed to in those cities. It's not that I'm arguing that point. And then when you consider who commutes in to work inside these communities, we've probably got 75% of our community currently under it. And so I want to tread somewhat lightly before I just look at the smaller municipalities and tell them, we're going to make you do what we want you to do. If there's buy-in from them and they're ready to move forward on it, then we need to have a meeting and a discussion. But that's where I'm at right now. It's not whether the mask works or doesn't work. I think we're doing the right thing. Businesses are already dialed back. They're already, we've got offices in town that I'm aware of. They're already working from home again. All the right steps are being taken. And I feel confident that it's heading in a direction that we'll see the percentages start to drop. I just want to be very careful in the decisions that we make.
Right. Agree.
Judge, if I could, listening to the discussion and piggybacking on what Commissioner Perry said, in that we want to make sure that we're proceeding in the best productive and the smartest way possible. I'd like to offer this. I do think we need to see if any of the mitigating actions that our businesses are taking here recently within this time period of all the acceleration of cases and deaths. But I want us also to understand we've been asking businesses to really sacrifice. Our first responders, our medical professionals have been working since day one, and they have families too. And I think it's on us to keep the community as healthy as possible so that we don't overwhelm our medical system. I'm listening to the discussion, and I know when I'm looking at the facts that I'm looking at is that we have 496 active cases, and that's 3 times more than the number we had last week. Last week, we had 153 active cases, and that was 5 times more than we had from the previous week when we had 30. So something is accelerating the cases here in McLennan County. Didn't get the count for Saturday. They said that's going to come out later, but Friday's count added 73 more cases to our positive numbers. And last week, we saw cases per day a surge that we haven't seen since we started looking at and tracking those infection numbers. And last week with 394, 1/4 of those cases, 111, were between the ages of 20 and 29. These are young people. These are young people. We do have 11 cases in the hospital. 5 of those were on ventilators. You talked about our positivity rate. I remember 2 weeks ago when the mayor talked about it, it was less than 1%. It was 0.48. This past Tuesday, when he did the press conference, it was over 10%, almost 11%. So our case numbers are not going up because we're testing more. Our case numbers are going up because the more people we test are testing positive. And I think it is on our shoulders because we are government too, as are our city and our school districts. But the county is a part of the state government. We are an agency of the state and we are government. And it is a moral obligation on us to safeguard the public safety. And I understand we have to balance that with individual rights. I understand that there are some issues with, do we put the responsibility on businesses? But the responsibility on us is we must do something. We must do something. I hope we can get Commissioner Perry the data he needs. I hope we can get Commissioner Jones the data he needs. But I think in light of what we already know, we have to do something. And I was reading over the weekend, I think I was sent like about 7 studies. And I was reading over the weekend where it said that we have to use science in our decision. I think someone told me that we had 9 deaths. We had 9 deaths. I think that's the number that I'm hearing. 3. That would put 3 in a day. I know we want to allow governments to think on this and do what they need to do. I just think it is imperative that we secure that information and we do something now. I'm not saying in this moment, but we must do something at this point in time to ebb the tide of what we see is happening here in McLennan County. I think in the final analysis, the public is going to hold us responsible if we don't.
Thank you. Anything else? Anyone would help?
Are we saying we're going to hold this until tomorrow and get them data? Is that what the 2 commissioners are asking for? Or I just want to kind of know what train of thought you have.
Well, that was a question I asked Commissioner Perry, if how long it would take him to get the information. We are posted for tomorrow morning for our regular schedule meeting. The reason why we had this morning is because tomorrow's meeting is going to be fairly lengthy, and I felt like this needed plenty of time for discussion. But you know, we can if the court pleases, we could defer it until tomorrow, and then we'll see where we are tomorrow and figure out where we go next. So.
And I'm totally in support of the resolution. I have no issue with the resolution whatsoever.
And the resolution he's speaking of is the resolution that was put together just as a recommendation to the community, primarily following CDC guidelines, including but not limited to face mask and those things. But also recommended to other incorporated cities who do not have an order to look to see if they would like to establish an order customized to their community. Is that?
Yes, and the use of PPE and hygiene, things of that nature needs to be reinforced.
Yeah.
Because, you know, we're all looking, why are our numbers going up so much? Sadly, anybody that didn't think this was going to happen is being naive, because we had a holiday week and we had graduation, we opened the economy back up, and there's a switch, and people forgot about COVID. So we should have seen this coming. I don't like the numbers we see at all. I do not like the numbers we see at all. But we have to reinforce the basic mitigation techniques.
That
Resolution, I think, does a good job of that.
And the demographics show that a lot of the increase were in the younger folks who get out and travel more social. And fortunately, only about 15% were individuals 60 years and older. And so that's the population that, we're trying to protect. Well, so I would entertain a motion to defer till tomorrow on the order. Yeah. Okay, there's a motion.
You made the motion or you missed it?
I was suggesting it, but I can.
I'll make the motion to defer.
Okay, there's a motion to defer item pertaining to the order.
Second,
There's a second.
second.
Did Commissioner Miller second?
I did.
Okay. All right, we have a motion, second. Any discussion? If there's no discussion, call for a vote.
Commissioner Sale,
Aye.
Commissioner Miller.
Aye.
Judge Hilton,
Aye.
Commissioner Jones. Commissioner Perry.
Pass. And then in regards to the resolution, I'd say we just hold it as well till tomorrow. So is there a motion to defer the item pertaining to the resolution? Is there a second?
Second,
Motion made, second. Any other discussion? No other discussion, call for a vote.
Commissioner Sale,
Aye.
Commissioner Miller.
aye.
Judge Hilton,
Aye.
Commissioner Jones.
Aye.
Commissioner Perry.
Pass. Okay, I think we have an item pertaining to our policy. What's under item E2 is approve an order establishing a county facility opening plan to prevent the spread of COVID-19 and ensure the health and safety of employees and members of the public visiting county facilities. So, Dustin, are you going to present that? Amanda is in the court, but I don't know who's supposed to present it.
Judge, it's really whoever. What this does is Amanda can you hear me, Judge?
Barely.
Judge, it can be either me or Amanda or Mike. What this does is it takes some of the items we had in our kind of reopening plan and turns those into policy. It sets out some cleaning guidelines, hand sanitizing stands be placed throughout the county. And then it goes into that each employee will receive a temperature screening upon entering a county facility at the beginning of their shift or business day. And then also talks about temperature screenings for any individuals entering a court facility that houses a courtroom. Then it further goes on to state that employees working directly with the public on a walk-in basis must wear a protective mask while dealing with each customer where social distancing cannot be maintained. And then in offices, departments where employees work directly with the public on a walk-in basis, the public visitors will be required to wear a mask where social distancing cannot be maintained. It also goes on to say that department heads and elected officials can impose stricter mask policies on their employees, just depending on how their unique situation, how their offices are configured.
Okay. Any questions on that?
I have one question. And that was on number 9, when it talks about employees who have to be sent home because they would have a temperature that would reflect they couldn't stay. If they had a temperature 99.6 or higher, they would be asked to go home. My only question is the sentence that says if leave benefits do not apply, or if the employee has exhausted leave benefits, the employee may be sent home on unpaid leave time. And we're talking about employees that are showing up for work, but their temperature is in that range where, according to the CDC guidelines, we have to send them home. So I know we've had employees that have exhausted leave because they've been out. But when it says that the court makes it mandatory for them to go home for those 3 days, if an employee does not have the compensation leave benefit, I'm wondering, and I'm hoping Amanda's on the call, can we establish, like we do, a sick leave pool? I'm trying to find a way that the employee is not penalized because they are sent home on a mandatory policy that we have. Is Amanda on the call, Dustin?
He is not.
Okay, that would be my question. That would be my question. I agree with everything in it except for that clause that says they will be sent home on unpaid leave. I don't think we should put that shoulder on people that are already shouldering financial burdens during this time. I don't think we need to insult injury. If we could address that, maybe like a sick pool does sometimes, set up a fund if they didn't have benefits, or even if they do, to establish a fund that would compensate that employee if they have to go out for those 3 days.
The only thing is there, Pat, is the city of Waco has shut down businesses. We've shut down businesses. Those people aren't getting paid. And if somebody's exhausted their sick leave time, they've exhausted it. But we've got a lot of people out there right now that aren't getting paid anything at all because the government has shut their business down.
That's true, and I feel for and I feel for them. That's why I'm glad we have tried to implement some policies to take that pain away. But even in light of that, I don't think we should penalize county employees because there are other individuals that have nothing to do, who are not associated with the county, maybe going through pain. I don't think we need to burden our employees with a policy that we are creating because of a guideline that the federal government says we have to adhere to. If you have an employee that shows up for work, they come to work. But if we implement a policy that says we're going to screen them for temperature, and then it reads at a certain rate, but they don't have any leave, to send them home and then for it to be on unpaid leave, I don't think it should be on the employee. But then again, maybe that's something that Mike Dixon needs to answer, and Amanda.
Okay. I think Mike also is having some technical difficulties. So unfortunately, we'll have to carry that discussion over till tomorrow to the regular scheduled meeting. Anything else? All right. Yeah.
I'd make a motion to defer.
Second.
Motion made and second. Any other discussion? No other discussion, call for a vote.
Commissioner Snell,
Aye.
Commissioner Miller,
Aye.
Judge Dalton,
Aye.
Commissioner Jones,
Aye.
Commissioner Perry.
Pass. Okay, anything else to come before the court? Dustin, is there anything else?
No, sir, that's it.
Okay. All right, we stand adjourned.